What's up, movers? Today we're going to demonstrate and teach you how to open up that front hip, or sometimes called the front butt. The front butt is super important to not only your hip, but also your lower back. If you sit for a long period of time, those muscles, especially the hip flexor, becomes approximated, and when you stand up, you're like that old man trying to get in that upright position. So one of the strategies you can utilize from a three-dimensional aspect is the use of the removed power band. This is one of the great moves that we use with this, but it may sound or look a little bit weird, but our band works best directly on the skin to get that myofascial and skin component to it. So we're going to bring the short up, we take that band and place it high up into the hip in a comfortable position. So in that position, we're going to kind of load up. We're going to use that band on our TZ2 or our push-up phase leg. So once we get into this position, get a little bit wider foot position, that way you can keep some balance. And from here, we're going to go frontal plane first. We're just going to glide forward and back, and you're going to feel that band pull on the muscle, the skin, and open up that hip joint. So about 5 to 7 reps from side to side, that frontal plane. Then we're going to go in that transverse plane where we're going to pre-position the opposite arm in front of you, kind of like you're running. So when you get into this position, we can just kind of glide forward and back to further open that up. And then last plane of range of motion will be that sagittal plane. So we keep that leg in the back position, or TZ2 position. We can also go bilateral arms at overhead and just coming through here to really allow that tissue to open up and stretch. You'll get a much better stretch this way. So last one you can do is incorporate the sagittal and frontal plane where you're doing the same side arm and overhead reach. So continuing on with it, we can get into that quadruped position where we get into all fours, and we really concentrate and focus on relaxing the hip. Let the band pull that femoral head into that posterior aspect of the acetabulum. Once you get that relaxed, then you can also do just little micro movements of internal and external rotation of the femur. So you want to get some work done, but don't traumatize it. If you experience any pinching or sensation that it doesn't feel good, back off the intensity or reposition the band. So I think you're going to really enjoy that one. So get out there and remove today.